we're doing any one of our therapeutic modalities, that we get the patient or client to rest. Sometimes they call me the lazy man's clinic. Some people like it. But eventually I do put physical therapy and activities and working on the sympathetic drive. But it's the more healing you need to get, the more you want to just take time off. You know, I had to take time off work. I had to take time off because I couldn't manage being active and having the sympathetic going while I need the body to be healing from a major back fall. And you could take that concept to any or application to any medical condition, whether it's a cancer, whether it's a heart disease, or whatever it is. Allow the body to take time to heal, give it extra healing factors, and just watch. And it's very, I don't mean to simplify, but then we can accelerate this with practitioners, with cardiologists, neurologists, acupuncture, chiropractor, whatever modality. You know, these people have specialized training, and if we give them a good base body of energy, then I think we can get a really good unified system in our healthcare approach, which again is what we're targeting with Wellness Without Limits.
Well, I really like the Wellness Without Limits. It brings up wonderful possibilities. And with your research and your background, you're backing it up with reality, you know, with scientific reality. So one other thing, could you take these things that you use for healing diseases and disorders, you know, for helping that, can you take that and accelerate the body's performance, say, as in sports applications?
Interesting you say that. One of the common abuses that happened with hyperbaric oxygen therapy was people thought, oh, let me breathe some more oxygen and it'll help my performance. Unfortunately, that's not the case, especially before a high performance activity. These therapeutic modalities are there to help in recovery. Apply hyperbaric right after your football game or hockey, or being Canadian, hockey, but you know, and accelerate the healing. Someone has a tear, a meniscal tear, or a performance athletic injury. Well, what will happen is you apply a series of oxygen therapies, and you'll get a more tensile, a stronger type 1 or collagen ratio, like a stronger repair, so a reduced, maybe hopefully a reduced risk of future re-injury. So it can definitely be important for athletics. Now, light therapy, I said, is very different, but are very similar, but there are differences as well. And one of the differences is light therapy can be used before certain therapeutic exercises, and we see that in some recent studies showing applying light therapy over the biceps, and then the patients were able to do more bicep reps. You see, so you know, we're still learning on the on how we can enhance the therapeutic sports performances. Fitness. But yeah, I could tell you one powerful thing that all of these does, even the peat therapy, which can be done, believe it or not, this mud bath that I told you about, it's one of my favorite treatments. If you have a bathtub, you can do it in your own bathtub. Safe, easy to use, doesn't stain the tub, and it allows you to get more blood flow and healing. But that peat therapy, along with the hyperbaric, along with the light, all have shown value post exercise and quicker recovery. So I think where it can be applied